Hey there, this is Dr. Joel Gould, and you're listening to my archive podcast called Get Your Smile On. This is a podcast that I recorded in 2015, and there's some really great information that I'm looking forward to updating with my new podcast called Revolution Radio. Stay tuned.
All right, everybody. Hello out there. And I am Dr. Joel Gould, and this is Get Your Smile On. I'm coming to you broadcasting live from beautiful Manhattan Beach, California. Today, we are excited to be back on track with all of our technology, and I want to apologize to anybody who listened to our last podcast who had a difficult time because of some of the technical issues. We're back on track. Tonight, we are going back to the land of vitamin D, and I am pretty excited to bring this guest on. Actually, what I want to do before I bring him on is I just want to remind all of you out there listening that we do have some international listeners. We've got people listening technically from around the world, and I encourage anybody who has any questions to ask to press 1 if you're actually live on this, and we will take any phone call or questions. So without further ado here, my guest tonight is Dr. James Dowd. He is the author of a book called The Vitamin D Cure, and he is a graduate of University of Texas Health Science Center for his medical degree. He also is completed internal medicine and pediatrics at the University of New York in Buffalo, and I have a feeling that that's where the vitamin D interest came in. I've been to Buffalo. It's pretty dark and gray there, let me tell you. And then he also has fellowship in pediatric and adult rheumatology at the University of Texas, a lot more sunny. And tonight I'm excited to have him on the show. Dr. Dowd, are you out there?
Can you hear me?
I can hear you. I can hear you so loud and clear.
Good.
This is awesome.
Great.
So
yeah, I'm here.
How are you doing?
So,
excellent. Are you back on the East Coast, correct?
I'm in Michigan.
Ah, okay. Very good. Very good. It's fall there, right?
Michigan is not quite as cold and dark as Buffalo, New York, but it's not too far from that climate.
I got it. Okay, well, I'm really excited to have you on the show, and for all of our listeners, they've sort of seen me go down the vitamin D rabbit hole here. I've had many guests just sort of discussing and discovering the different aspects of vitamin D. So my listeners, they know it's not a vitamin, and they've had a lot of information based on what I've been speaking with them about, and we've had some incredible guests on. But I was excited to have you on because you're a boots on the ground medical doctor who discovered this at some point in your career and has, I guess, not only brought this into your medical practice, but you've written an incredible book to help so many people with all these ridiculous issues about vitamin D that apparently still very few people know about. Can you tell us a little bit about yourself and how you got to this point in your career to be in Michigan and what you're doing?
Sure. So, I started out my career, I grew up in Houston, Texas, and in sunny climate, and that's where most of my undergraduate training and my medical training was in Texas. I did my residency, left to go to Buffalo, New York to do a residency in internal medicine and pediatrics, and then quickly returned to the sunny climate and swore never to return to cold, snowy climate again. Did my fellowship here and met someone from Michigan and followed her to Michigan, and I found myself right back in the snow and dark weather. And it was sort of, that was the serendipity that delivered me to vitamin D. I was seeing lots of patients as I started my practice, and I stumbled across a handful of patients. So, I started my practice outside, north of Ann Arbor, closer to Flint, and working for another group of rheumatologists. And there was a couple of African-American patients who came to see me. They had a specific type of arthritis that it sort of the literature would suggest was rarely associated with vitamin D deficiency. I measured their D levels, and they were undetectable, and I thought, this is bizarre. I didn't know this was even possible. They didn't teach us this in medical school, and so it was kind of a novelty finding to see patients who had no vitamin D, but it piqued my curiosity. A year or so passed, and I realized, okay, I've been living up here now for several years, and I'm starting to feel like my patients. I'm kind of tired. I'm achy. My joints hurt. what is going on here, and could there be a relationship between what's going on with my patients and what's happening to me? I quickly realized that, hey, maybe I've got the same problems that my patients do. Maybe my D levels low. I started supplementing, started changing my diet, trying some different things, and lo and behold, in a few months, most of my aches and pains were gone, and I thought, okay, I'm on to something. I need to start measuring D levels in all my patients. And as I did that, I found that some 80 to 90% of my patients, at least in the Michigan area, were vitamin D deficient, and this was tied to many of the complaints that they were bringing to me.
Yeah, it's pretty incredible. I'll let you know that it's not just Michigan, because we tested a bunch of our employees here in beautiful sunny Southern California, and not only, of course, I was low, extremely low, but not one single person was above 20, and we had a lot of people in the low teens. And
wow.
So, yeah, and this is happening right here in California, and let me tell you, it's been a sunny year.
Yeah.
So, yeah. And, I'm originally from Canada, so I wasn't surprised to find out that this has probably been the root cause of all of my medical issues. So I guess probably a lot of people in the medical industry might argue, but, in previous episodes we did talk about my Crohn's disease. I do have sleep apnea, and I got a bunch of issues that really shockingly cleared almost completely when my vitamin D level doubled, from under 20 to over 40. So I'm a firm believer. Just while we're on this topic real quick, question for you. Have you seen any correlation between vitamin D and toenail fungus?
There's clearly, that was, that was one of the sort of the shocking things I realized. Everybody was pretty familiar with, through our education, that D had something to do with calcium metabolism, is critical for calcium metabolism. It has something to do with bone growth, dental, formation of dentin and tooth growth and these sorts of things. But, I thought to myself, how does this have anything to do with the immune system? And it was sort of a revelation to me to start reading paper after paper showing there was a clear relationship between vitamin D and the ability of our immune system to develop tolerance to things, which was very important in allergy and autoimmunity, that it was important in fighting off infections of all types, fungus, bacterial, viral infections, and that they actually had studies, in vitro studies in test tubes, linking vitamin D pretty clearly through mechanistic actions to fighting these different types of infections and for cancer surveillance. And so I'm like, wow, this is really important to what I do as a rheumatologist, and I need to understand this better. And so I really dove into the scientific literature to understand that. So yeah, there's clearly a link with infection. Bacterial recognition proteins on the surface of cells, when they bind to coat proteins on viruses or bacteria, are taken into the cell, they actually turn on vitamin D mechanisms that produce active forms of vitamin D, and that stimulates the production of cathelicidin and other bactericidal proteins that actually kill bacteria. And these mechanisms are particularly worked out well in tuberculosis, but we're pretty certain that similar mechanisms are present for viral infections and fungal infections as well.
Right. Okay. Well, that makes perfect sense, and this is sort of my moment in time where, you'll be the 100th person that I said this to. As a medical doctor, you have a really broad range of education. Can you really, can you give me your elevator pitch reason as to why this isn't more well known and why more medical doctors just aren't aware of how critical that this non-vitamin is?
Well, so some of it is, I think a lot of nutritional things in medicine, generally speaking, got short shrift during our education. And my education, I think, as many doctors, was dominated by pharmacology and understanding how drugs work, not understanding less about how our body worked and particularly how we interfaced with our environment with regards to food, and more about how medicines worked. And so our whole training was sort of revolved around pharmacology and mechanisms of pharmacology. And and subsequently, I think we developed very sort of trite ways of looking at nutrition, not much different than the My Plate program or the food pyramid, and we really didn't give it much more attention than that. And we still see vestiges of that. I mean, when I sent, this was only 10 years ago when I first started discovering these things about nutrition and micronutrients and hormones like vitamin D. I said, well, okay, I may not be the expert. Let's have you go see a dietitian. And the patients would come back with literally a piece of paper that had the food pyramid on it. And they say, well, this is all they told me, Dr. Dowd. I learned more from you about nutrition in one visit than they told me in half an hour. All I got was the food pyramid. I'm thinking, oh my God, this is as far as the medical community has gone, and it's made no progress. So I think some of that's changing with the new food movement now. We see lots of people interested in growing their own food and knowing where their food comes from, and this is a great thing. I think it's really pushing the medical field to give us more information, and it's shaking these sort of old vestiges of how we thought about nutrition, and it's not that important. And as long as you get the quote food groups, everybody should be okay.
Right. Okay. Well, it's one of these. So it leads me to my next question. So when you started to incorporate this, and obviously, when you started bringing this forward, was any of your medical counterparts, any of your peers, did you get any kind of pushback, or was there any kind of question like, hey, look, this is silly. This is a vitamin, and it's not that important. Did you encounter any of that?
Yeah, I encountered that actually quite a bit. I should say that at one point I thought my practice was going to go under because many of the doctors in the community sort of abandoned me. They said, this guy's lost his marbles. All he talks about to our patients is vitamin D and dietary changes, and we're going to start sending him to some other rheumatologists who will put him on some drugs. And so there was actually more pushback from the physicians in the community than there was from the patients. I remember a patient came in and told me one day, she said, Dr. Dowd, my primary care doctor said he's no longer sending patients to see you, and he would really like me to see another rheumatologist because all this doctor does is talk to his patients about dietary things and lifestyle changes and vitamin D. So I have one question for you, Dr. Dowd. Can you help me find a new primary care physician? And so I mean, it was a little bit of a shock to me. I mean, I knew my new patient volume had dropped off when I started really getting obsessed or passionate about this new way of seeing medicine, because it really, you get it to 7 or 10 years into a career, and you start, there's lots of patterns that develop, and you might even get a little bored, and you say, okay, either this is as simple as this career is going to get, and it's the same old stuff over and over again, or I'm just not seeing it the way it needs to be seen. And so this whole revolution in my mind of vitamin D and diet and the importance of our interface with the environment was a critical paradigm shift in the way I saw health and disease. And it totally invigorated my practice. I now saw my patients as these very interesting people coming and say, "Oh, I can help you with all this stuff," and I would just dive right in. Whereas before it was like, "Oh, another patient with fibromyalgia. Here's a medicine for this, and here's a medicine for that." So it was a dramatic shift from practicing medicine the way I was trained to finding a completely new way to practice medicine. And I frankly said to myself, okay, if I'm going down in flames, I'm going down in flames with a smile on my face, enjoying medicine more than I've ever enjoyed it in my entire career. And lucky for me, I picked a topic that was in the public eye as well. And study after study, every week a new study would come out with vitamin D, and it was making the headlines. And then when the book came out and it did well, and there were more people talking about it on these doctor shows and things on TV, eventually the community that I practice in, sort of the microcosm I'm in, sort of came around and said, okay, maybe he wasn't a whack job after all. He was actually onto something. So now my practice is booming, and I'm very busy, and actually the internet has helped with that too. Because are actually shopping for their own doctors. It's no longer my primary told me to go see this doctor, and then they just do it like autopilot. They actually say, okay, I'll take that name, but I'm going to go on the internet and I'm going to do some research, and I'm going to see if that's the actual specialist I want to see, or if I want to find my own rheumatologist. And I'd say 50% of my patients now say they found me on their own. My doctor said to go see a rheumatologist. They wanted me to see someone over here, and I found you, and you're the one I want to see because you have the same way of thinking about this as I do.
Right. Well, what's so interesting is we're going to go for a break in 1 second, but I just sort of want to chime in here because this is really it's a paradigm shift. It's a different way of looking at basically general health care, and it's one of the things that I've really been focused on here. I'm calling myself a wellness dentist, and I had to define what that means. And wellness is really all about prevention. And we're stuck in this model of disease and pill, disease and prescription. And I love my favorite thing to say is I'm a holistic dentist with a WH, and I want to look at the whole person. So I love what you're doing, and I love to hear. And this is kind of exactly. I would be a little worried in a small town that you might be viewed as a quack, and then to see that you regained your stability there because your patients aren't dumb people, and no one wants to have 2, 3, 5 prescriptions every time they go to a doctor. They get another prescription. Okay. All right. So hang on 1 second. We're going to take a short break to let some of our sponsors give their message. So hang on. We'll be right back. All right. We're back talking with Dr. Dowd. Are you still there?
I'm still here.
All right, great. Okay, so what I really wanted to sort of talk about having a real practicing doctor, and I'm at the end of the show, I'm going to make sure everybody knows how to get a hold of your book and how to look you up. What I loved about the book, and so many books, they talk about a lot of things, but they don't give you any action plan. There's no real way to actually start to make a change. And I really like the aspect of your book that it's sort of an informative book, and it's a how-to book, and it gives you recipes and literally and figuratively. So I want to talk just briefly about, to me, how I got into this was through sleep apnea. And I know that one of the, so in my opinion, that the two single largest public health care issues facing America and probably every Western country is vitamin D deficiency and sleep apnea. Because in my opinion, regardless of what's what's out there, I believe they're very, very highly linked. Can you make any comments about sort of the sleep apnea vitamin D connection in any way that you've seen? And this may be something that I'm focused on it because I'm treating a lot of this. But go ahead.
Right. So sleep apnea, the major risk factors for sleep apnea are age and obesity. And certainly both of those have links to vitamin D deficiency. So as we age, our vitamin D levels tend to fall. And this has several things. Our liver makes less pre-vitamin D, so there's less for conversion by sunlight. Our skin is less efficient in that conversion process in twisting the molecule and then sending it back to the liver for further activation to 25-hydroxy-D. We tend to avoid the sun as we get older because we have problems with our skin and sun exposure, with skin cancer rising after age 50, and some of that is just our mechanisms for surveying and fighting off cancer and repairing damage from UV light is impaired as we get older. And so those two things, those several variables lead to lower vitamin D levels in people as they age. And then as far as obesity goes, the bigger we get and the bigger our fat stores are, so the more fat mass we have, the more our vitamin D is sequestered in that fat, because our vitamin D comes from cholesterol. It's a steroid hormone, and it's fat soluble. And so just as over 40 and 50 we begin to lose lean body mass and acquire more fat mass, these fat soluble nutrients like cholesterol-based like cortisol, testosterone, estrogen, vitamin D, vitamin K, vitamin A, vitamin E, all of these things are sequestered to some degree in our fat stores, and they're no longer found in adequate concentrations in our circulation where they're doing their thing. And so you do see imbalances of vitamin D related. So the question, though, then is there cause and effect here, or is this just a epiphenomenon that's occurring because all these other things are going on at the same time? I don't know that I could answer that directly. I'm not aware of direct studies looking at apnea, and maybe you can teach me something here between obstructive apnea and vitamin D. I can say that I probably have some degree of that. I know my wife says, you snore like a freight train, and so I ended up getting some bite splint that pulls the jaw forward a little, and that completely eliminated the snoring, and my sleep did improve. Now, I'm not fat. I'm 5'8", 135 pounds. I'm about as skinny as you can get, and I exercise every day, and my D level, at least for the last 8 years, has been normal on supplementation. So I don't know what the direct link is. I know there's these associations because of age and obesity being two risk factors for sleep apnea. There may very well be a direct link, but I'm not familiar with it. So tell me, do you know what that link is? Have you read some papers that I'm not familiar with?
Yeah, so two of the experts that I had on my show, one of them, Dr. Stephen Park, he's quite sure, or he believes that sleep apnea will reduce your vitamin D, having to do with the hydroxy group. It's something too boring to talk about from our listeners. And then we had Dr. Stasia Gomanek, who said vice versa. She basically said that low vitamin D will cause you to have sleep apnea. So, and her thought process was that the part of the brainstem that regulates airway and sleep and everything is highly vitamin D dependent, and that low vitamin D will affect sleep. And so you actually get it. Yeah. It's
I mean, and that makes some of that makes sense. I mean, you think of vitamin D as a hormone that is tied closely to the circadian rhythm. Day-night cycles, and during the day you're making D, and at night. So there probably are some day-night fluctuations with mechanisms of production of vitamin D just related to sun. And so maybe clock genes that we have that are tied to pacemakers, whether they be pacemakers in our respiratory center or otherwise, could be influenced by D. I know there are some data. I haven't looked at it recently, but I know that some clock genes are influenced. Their expression is influenced by vitamin D.
Right. Okay, well, there's actually a lot of stuff that I'm working on. I'm not prepared to bring all my hypotheses out, but I've got some interesting stuff. It's really fascinating being in the position that I'm in, because I get to see so many people, and I get to see them every 6 months for over many, many years. So I'm seeing how people's health is either improving or deteriorating. And what I'm so excited about just finding out about vitamin D is there's so many of my patients that are literally suffering from so many of the different things that you talk about in your book that I'm so happy to be able to be at least one source of information where I'm helping them to actually supplement their vitamin D. But a lot of them are getting reports from their doctors saying, yeah, you're really low in your vitamin D. And I asked them, what did you do? And they said, oh, well, I started taking 1,000 international units a day, and then I have to say, okay, well, that's great. And in 300 years, you might be, you might get your level up.
Right.
But so it's very interesting. Okay, we're sort of running out of time here. I want to ask you what you think is sort of the most shocking, or what do you think that your top three, wow, I can't believe vitamin D deficiency could even be any part of this, but it kind of is. What do you notice just out of all of medicine or health in general?
Well, so I think that it's so some critical things that I think are takeaways that you want to digest. Vitamin D regulates gene expression through a variety of ways, and it's particularly important from an epigenetic perspective, and it influences gene expression early in human development. So during fetal development and in early childhood, where lots of things are still sort of adapting to the environment that you're born into, or being born into, if you will, that it's absolutely critical that pregnant women and children have normal vitamin D levels. And I don't think that's, as much as it's hard enough to get adults to understand the importance of it and get it measured, I think it's getting even less attention in childhood. For some reason, we think children are just sort of bulletproof, and it doesn't matter what you do, they're all going to turn out fine. But I think that's being too cavalier, and that we really need to focus on children and pregnant women, because that's where genetics and epigenetics are heavily influenced, and health for several generations after that can be influenced by normalizing vitamin D. And this has to do with risks for diabetes and heart disease and obesity. The Barker hypothesis tells us that from studies during World War II, that if you were starving during pregnancy, your risk for your offspring 40 years later was threefold higher for diabetes, hypertension, and heart disease, and that vitamin D deficiency early in life may increase your risk for a whole host of diseases in the same way. And so that's the time in our life when we can have the most impact on all of these variables that D affects is by normalizing D during pregnancy and early childhood. For everything, bones, teeth, immune system, cancer surveillance, risk, all of that stuff.
Right. Wow. We know what's funny is that I always ask. We got a lot of pregnant patients here in Manhattan Beach. This is a very young family area, and I'm going to say that about 40% of the people that I hear at my office, they are not giving their newborns or children any vitamin D supplements, and they are not taking any themselves, which is really shocking considering this is Los Angeles. This is no backwater place, and that if there's 40% of the doctors aren't even telling their new mothers to give it to their newborns, it's a huge issue. When I mention it every time, I feel terrible because the look on the mom's eyes like, what? No, we're not giving any vitamin D drops. And I say, listen, I'm just a dentist, but I think that you should call your doctor, and I think that you need to start getting some supplementation. So,
well, I think the OBGYNs, there's a gap there with OBGYNs, and then there's a gap between the birth of the child and that first visit. There may be 6 weeks there where nobody's really paying attention, and that's a critical time that we're missing.
Yeah, and then we've got the poor mom who's going to be so D deficient after having a child, and they're still taking, if they're taking a prenatal vitamin, they're getting their 500 international units of vitamin D, which is doing nothing. So
right, and studies show that breastfed infants are notoriously low in D, and the American Academy of Pediatrics recommends supplementing the breastfed infant. But the real problem is the mother has extremely low levels while she's breastfeeding, and if you supplement the mother to get her D level up around 50, then there's enough D in the breast milk that both the mother benefits from this and the child benefits from this, and that's the ideal way to take care of that situation.
Yeah. Well, this sort of reminds me. I had Dr. John Cannell on the show, and he said something that kind of really got my attention. I said, because this is a question I usually ask, because we're reaching the end here. It's like, when do you think that the tide's going to turn? When do you think the general public is going to know this? And when do you think all the medical professionals are going to know this? And his basic answer was fantastic. He said it's going to take 1 or 2 lawsuits for the children of autistic, for the parents of autistic children to find out that their medical doctor did nothing supplementation-wise for pregnancy or for after. And I kind of thought, well, that's the world we live in, that there has to be a financial concern attached to it. Otherwise, really nobody cares.
Yeah, and I think we've come a long way. At least in the microcosm of where I live, most of the patients that come to see me from the county that I'm in now or close by to the county I'm living in now, by the time they see me, they've already had their vitamin D level measured by their primary, and they're either on supplementation, whether it's appropriate or not, they're on supplementation. But you go a little bit further out from my practice, say you get 25 or more miles away, and it starts dropping off pretty quickly, and the new patients coming in, it's not even on the radar. So, all we can do is keep the noise up and keep shouting about it to keep it in the forefront of their mind.
Yeah. All right. Well, I think that you've done a great job, and your book, like I said, is very simple and easy to read. So I'm just going to go ahead and say, why don't you let our listeners know how they can find you or your book? Why don't you tell us?
Okay. So you can find me on the web at drjamesdowd.com. I'm also a regular guest on One Life Radio, which you can hear on iHeart Radio, which is broadcast primarily out of Dallas, Texas, but is syndicated in a number of other cities. And you can buy my book on Amazon, Barnes & Noble, or any other online retailer.
Okay, great. Well, Dr. Dowd, thank you so much. I really appreciate your time, and thanks for staying up late for us a little bit. And I hopefully look forward to maybe having you on the show again when we gain a little bit more attention and notoriety about bringing this silly, simple, and easy to fix major health issue to the forefront of modern medicine in America. Thank you so much.
Yeah, thank you, Joel. Thanks for having me on. I appreciate it.
Great. Have a great night. Thank you.
You too.
Thanks. All right, everybody, that was Dr. James Dowd. And, I for my listeners, I've taken you, through the different ways to view vitamin D. This is really great for me to hear about somebody, I guess really still a huge trailblazer, bringing this information to their general practice and just thinking about how many people's lives have been helped and affected by just doing something so simple as supplementing the sunshine that we should be getting in our lives. All right, on that note, I would like to say thank you all for listening. And for future episodes, we're going to talk about having more people call in and let you know how to actually do it, because I'd love to hear some of your questions. And that's it for tonight. Thank you for listening to Get Your Smile On with Dr. Joel Gould. Have a great night, and we'll see you next week. Thank you.